According to my professional experience, the hip and joint areas are very important mid-sectional joints that, when it's not properly aligned, can affect other areas such as, but not limited to, shoulders, neck, knees, ankles, and feet. Therefore, massage therapists should focus on localized deep tissue mobilization, or LDT, on accumulated muscular tension of hip-related areas. With the client on prone position, this LDT should start on the lower back regions with general compression, friction, petrissage, hacking, and joint range of motion to increase flexibility. Next, the work should be redirected to the gluteal regions using similar massage stroke as before, but with the addition of muscular scraping of the posterior lateral aspect of the sacrum and the greater thoracanal attachment regions. Muscles to receive LDT on this area are the gluteal group, piriformis, and internal hip rotators. Additionally, LDT should be applied to the hamstring muscles, followed by, later on, a piriformis stretch. Muscular scraping of the lateral posterior aspect of the sacrum. Muscular scraping of the greater trochanter regions. Hip rotation, followed by piriformis stretch by stabilizing the side of the hip with the opposite hand. Now the therapist should repeat the same sequence on the opposite hip side. With compression, friction, joint mobilization, or spinal rock, similar massage strokes on the gluteal region. After relaxing the gluteus maximus, focusing a little bit more on the deeper internal hip rotators, including the piriformis. Muscular scraping of the posterior lateral aspects of the sacrum. Muscular scraping of the edges of the greater trochanter, attachment of muscles. Make sure you have a good health history of your client, because some health conditions or some post-operative situations may incur some contraindications or modifications to this procedure. LDT on the hamstring region, including the hamstring attachment or the superior attachment. Followed by hip rotation with piriform stretch by stabilizing the sacral region with the opposite hand. This is a gradual stretch. Do not overstretch, but slowly feel for the resistance and do not overdo it. The work with the client on prone position should end with lumbosacral decompression and hacking. Now with the client on the supine position, the therapist should initiate the work by doing a rocking of the leg, which will help or assist with the internal lubrication and relaxation of the femoral iliac joint. Apply gentle LDT on the quadricep muscles and also on the adductor muscles. A little more of a localized deep tissue on the upper attachment of the quadriceps, followed by a range of motion of the hip or rotation, which assists with internal lubrication of the joint and relaxation of tendons and ligaments. Next will be the stretch of the short adductors by stabilizing the opposite iliac region. And now the stretch of the long adductors. Now by asking the client to move to the edge of the table and making sure the client is properly safe, secured, initiates the stretch for the iliopsoas muscles by stabilizing the opposite hip and pushing that working leg down. It's always good to have the client holding on the opposite side of the table. With the client on the center of the table now, initiate the same work on the opposite hip area with LDT on the quadricep muscles. LDT on the adductors. Make sure you're aware of the amount of pressure you can put on the adductors, since that is a sensitive area in most people. Muscular scraping on the superior attachment of the quadriceps at the ASIS region. Joint range of motion and rotation of the hip. Followed by the stretch of the short adductors. By stabilizing the opposite hip area. Now the stretch for the long adductors. Make sure to pay attention to the resistance when you initiate the stretch. Do not push or move beyond what the body is allowing you to or resisting to. This has to be a gradual stretch by waiting at least 15 seconds on each phase of the stretch. Now with the client at the edge, on the edge of the table, initiate the stretch for the iliopsoas by stabilizing the opposite hip area. Push the working leg down towards the floor and having the client holding on the opposite side of the table for stabilization. With the client back in the center of the table. The last portion of the LDT for the hip release will involve the placement of a soft object between the legs on the superior upper thigh region. The therapist, in this case, will lean back by holding the client's ankles and at the same time bringing the ankles internally towards each other. Two processes of movement involved, which is stretching of the lumbar region by leaning back, along with medial compression of the medial malleolus or ankle regions. It's a gradual stretch. With this, you have the completion with hacking of the quadricep regions. And that the total hip release is completed.